In this discussion, we'll look at the mechanism of normal labor, also called the 7 cardinal fetal movements in labor. So we need to understand that there is a mechanism for every fetal presentation and position which leads to a vaginal birth. And this which I'm going to discuss is mechanism of normal labor. And the 7 cardinal fetal movements in labor are descent, flexion, internal rotation of the head, extension of the head, restitution, internal rotation of the shoulders, and lateral flexion. Now we're going to look at the diameters on the brim, cavity, and outlet of the pelvis. Starting with the brim, the anteroposterior diameter measures 11 centimeters from the symphysis pubis to the sacral promontory. The oblique diameter measures 12 centimeters from the iliopectineal eminence to the sacroiliac joint on the opposite side. The transverse diameter measures 13 centimeters across. Now we move to the cavity. The cavity is round, and so all the diameters measures 12 centimeters. Then lastly, on the outlet, the anteroposterior diameter measures 13 centimeters from the lower border of the symphysis pubis to the sacrococcygeal joint. The transverse diameter measures 10 to 11 centimeters between the ischial spines, and it is the narrowest diameter on the pelvis. The oblique diameter measures 12 centimeters for the outlet. Now that we've learned about the diameters of the pelvis, we move on and look at mechanism of labor, starting with descent. So descent is a downward movement of the fetal head through the pelvis, and this happens as the muscles of the uterus contract and retract. At this point, the occiput of the fetus will be placed at the iliopectineal eminence, and the sagittal suture will be in line with the oblique diameter of the pelvis. The second cardinal movement in labor is flexion. So as the fetus is descending and with contractions, it meets resistance against the pelvic floor muscles, causing the chin to be tucked, touching the chest. At onset of labor, suboccipital frontal, which is 10 centimeters, presents, but with greater flexion, suboccipital bregmatic, which is 9.5 centimeters, presents, and the occiput becomes the leading part. So this cardinal movement allows the smallest diameters of the fetal head to pass through the pelvis. So the third cardinal movement in labor is internal rotation of the fetal head. So during a contraction, the fetus is pushed downwards and meets resistance from the pelvic floor muscles. This resistance causes the head to rotate 1/8 of the circle in a well-flexed vertex presentation. This causes a slight twist in the neck as the head is no longer aligning with the shoulders. Then the sagittal suture will be in line with the anteroposterior diameter. Then the occiput will be beneath the subpubic arc, just below the symphysis pubis. The fourth cardinal movement in labor is extension of the head. So after crowning, the head extends, pivoting on the pubic bone. This releases the sinciput, face, and chin, which sweeps the perineum. The fifth cardinal movement in labor is restitution. The twist in the neck of the fetus, which resulted from internal rotation, is now corrected by a slight untwisting movement. The occiput moves 1/8 of the circle towards the side from which it started from. The sixth cardinal movement in labor is internal rotation of the shoulders. So the shoulders rotates forward to lie along the anteroposterior diameter of the pelvis, and the anterior shoulder is placed under the symphysis pubis, and this results in the head to turn externally, which is also called external rotation of the head. And the seventh cardinal movement in labor is lateral flexion. The anterior shoulder is born first, followed by the posterior shoulder, and the baby is delivered by lateral flexion. If you need more explaining on this topic or any other topic, please feel free to contact me.